Hi everyone, our project today is a dietary intervention. My name is Caroline and my group mates are Althea, Brett, and Leanne. So for background and significance, obesity in adults increases the chance of developing type 2 diabetes, heart disease, strokes, and many types of cancer. Childhood obesity can cause low self-esteem, anxiety, depression, and social problems such as bullying and negative stigmas. Some common causes of childhood obesity include unhealthy food choices, lack of physical activity, and a family history of obesity. And it is predicted that by 2030, nearly 50% of Americans will be obese. So our intervention targets high school students in San Diego. Adolescents spend most of their day in a school, which is why school setting is a convenient access point for a dietary intervention. Our goal is to improve healthy eating habits to prevent obesity. And then moving on to intervention and implementation.
Our intervention study design is a cluster randomized control where we take 17 high schools out of 33 high schools in the San Diego Unified School District as our intervention group and 16 high schools out of 33 high schools as our control group. The duration of our study will last 9 months or a whole school year. We will use a self-administered questionnaire regarding the type of food they ate during every meal at the beginning of the school year and 9 months after. Our intervention group will receive nutritional education from health specialists every month for 45 to 60 minutes. The cafeteria in our intervention group will offer more fruits and vegetables during lunch. This group will also have posters around campus to remind students of the importance of healthy eating, and this group will also have access to vending machines with healthy snacks. Our control group will have no adjustments to cafeteria food, will not receive nutritional education from health specialists, and will have no access to vending machines. Our hypothesis is that students in the intervention group will be more likely to make healthy food choices from baseline to 9 months as measured by questionnaire than students in the control group. In order to retention, all students will receive the same information by the same health specialist to ensure that all students will have the same nutritional knowledge. We will also have weekly in-class QR codes or Google Forms in the beginning of class about how healthy they ate for the week. We will also have teachers motivate students to track their fruits and vegetable intake weekly for the duration of 9 months as an extra credit.
A quick overview of our logic model includes inputs of grant funding for education by health specialists and vending machines. The outputs of the intervention create changes at the individual and community level, with short-term outcomes including healthier eating habits and long-term impacts preventing the risk of obesity and decrease of inflammatory markers. Based on the social ecological model, our intervention will mainly focus on the individual and community levels. For individual, we will focus on health education that will be given by health professionals, and the community level will focus on increasing access to healthy foods. Some constructs included in our intervention will be reinforcements, which can be done by teachers providing healthy snacks for students in school, and self-efficacy by practicing positive self-talk throughout the intervention to continue healthy eating habits. Additionally, other constructs include self-control by consciously controlling and being aware of what one is putting into their bodies, and vicarious learning through role models such as teachers and faculty members eating healthy as well.
For process evaluation in our study, we had a few different examples. Some of these would be ensuring that there are always healthy options available for students in the cafeteria or in their classrooms, making sure the weekly Google Forms are being filled out, students being taught about the benefits of healthy eating, and having posters placed all around the schools to help form healthy eating habits. For outcome evaluation, we have the students answering 4 different questionnaires. The first one would be before the study took place, and this would gauge the students' knowledge on healthy foods as well as seeing how many fruits and vegetables the students consume daily. The second one is halfway into the study. This one checks to see what they've learned so far and if their habits have changed at all. The third questionnaire is at the end of the 9-month period, and this one also checks to see if their habits or knowledge has changed over the course of the study. The final questionnaire is 3 months after the study has ended, and the point of this one is to see how impactful the study really was on changing the student's diet or lifestyle. For impact evaluations, we said that by enforcing healthy eating habits, we can decrease the rate of obesity in young adults. This may also have a lasting effect on their adulthood as well as their family and friends. By changing dietary habits, we also expect to lower the risk of food-related diseases such as heart disease or diabetes. That's all we got. Thanks for listening.